We also welcome on dais the awards jury chairman Shri C.K. Mishra ji, former Secretary, Ministry of Health and Family Welfare and Ministry of Environment, Forest and Climate Change, Government of India. We have with us awards jury co-chair Dr. Harsh Mahajan, Chair FICCI Health Services Committee and founder and chief radiologist, Mahajan Imaging and Labs. Also, along with the esteemed dignitaries, we have with us Dr. Sanjeev Singh, co-chair FICCI Health Services Committee Medical Director, AIM SRC Faridabad and Chief Medical Superintendent, AIM SRC Kochi. A warm welcome to all the esteemed dignitaries present at the dais. In order to start the event, foremost I request Dr. Harsh Mahajan to welcome our chief guest, very beautiful and gorgeous, Miss Sharmila Tagorji with the green certificate. We also request her to present a memento. With this green certificate, we pledge to plant 6 trees at Sundarbans National Park.
ये दोनों खड़े हुए बीच में यार ये नहीं फोटो वाला नहीं है.
Thank you very much. Thank you. I now humbly request Dr. Mahajan to welcome Shri C.K. Mishra ji with a green certificate. And request sir to kindly present a memento as well. Thank you, sir. In order to kickstart this wonderful evening, I now request Dr. Harsh Mahajan to kindly give away the welcome remarks. Over to you, sir.
Thank you very much. Our chief guest for the evening, Sharmila ji, guest of honor of the award and the awards jury chair, Mr. C.K. Mishra, former Secretary, Ministry of Health and Family Welfare and Ministry of Environment, Forest and Climate Change, Government of India, distinguished jury members, awards nominees and participants, and of course, FICCI Health Services Committee members, partners and members of the media. We are indeed honored to have Sharmila ji as our chief guest for this award ceremony, and the very fact that the hall is packed at this early hour is testament to your enduring and wonderful, the word actually escapes me, the love that people still have for you. Ms. Sharmila Tagore, as we know, is an iconic Indian actress who has made significant contributions to the Indian film industry. With a career spanning several decades, she is celebrated for her versatility and captivating performances in both Hindi and Bengali cinema. Sharmila ji has received numerous accolades for her work and remains a respected figure in the world of Indian cinema. She was conferred the Padma Bhushan in the year 2012 for her contributions to Indian culture through performing arts. She is also the recipient of 2 National Film Awards, a Filmfare Award, and a Filmfare Lifetime Achievement Award for her contributions to Hindi cinema. Apart from acting, she is also actively involved in social work, both in India and abroad. She is UNICEF's Goodwill Ambassador in the cause of HIV/AIDS, works for the corneally challenged at the Venu Eye Institute, and is a board member of the PSP Trust. She gives general support for socio-cultural and community projects and supports asset survivors through the Patauti Trust. Sharmila ji, we are extremely thankful to you for gracing the occasion. Your presence adds a unique dimension to our gathering, and we are genuinely excited to hear your insights and experiences with the healthcare sector in India. Thank you very much. I would also like to welcome the guest of honor and jury chair, Mr. C.K. Mishra, who has been a pillar of support to FICCI, and under his guidance, the awards jury has selected the winners. I'm told that we take him for granted many times. I'll ensure that we are more circumspect going forward. With more than 30 years of public service, Mr. Mishra has served as an administrator, policymaker, and public health strategist, holding a wide range of assignments in the field of health, education, industry, and power. Prior to retiring as Secretary, Ministry of Environment, Forest and Climate Change, Government of India, he was Secretary in charge of Ministry of Health and Family Welfare and also held the additional charge of the Ministry of Ayush for some time. Mr. Mishra is recognized for his significant contributions to improving the Indian public health landscape. Earlier, as Additional Secretary and Mission Director, National Health Mission, he led one of the largest public health programs globally. During the pandemic, he has also led the Empowered Group on availability of hospitals and allied services in the fight against COVID-19, and it was indeed a unique honor that the Secretary of Environment was made to head the most important task force in healthcare during the pandemic. That only speaks volumes for what a person he is. It's great to have you here, sir. I welcome all of you to the 15th edition of FICCI Healthcare Excellence Awards. Thank you for accepting our invitation to share this moment of joy with us, where we celebrate excellence and innovation in healthcare. Today, we will be felicitating organizations and individuals for their efforts and exemplary contributions to the healthcare sector by innovating for increased efficiency, affordability, and improved performance of healthcare delivery. Those who have made the theme for our awards: inspire, change, together, a way of life at the workplace. As most of you are aware, these awards have emerged as the definitive recognition for contribution to healthcare in India, and over the years, based on initiative, sustainability, scalability, and impact, these form the key criteria for evaluation. I'm glad to note that with the legacy of a decade, FICCI Healthcare Excellence Awards have proven itself as one of the keenly awaited awards program. The awards are acclaimed by the industry due to its transparent, robust, and evolving process. I can tell you the jury members spend days on end evaluating the hundreds of applications that come in. I congratulate all the finalists and hope that their case studies will inspire others in the quest for a healthier India. I warmly welcome all of you again. Thank you very much.
Thank you, Dr. Mahajan, for your overwhelming welcome note. We appreciate it. As Sir mentioned, the awards instituted in 2009, recognizing the individuals and organizations for their commitment and dedication, their exemplary contribution and innovative work and transformations in the healthcare sector. Ernst & Young is the official tabulator and Astron Healthcare the supporting partner for these awards. As EY is the official tabulator of the awards, I now invite Ms. Sakshi Kishnani, Director EY, to briefly explain about the evaluation criteria and selection process that makes these awards so distinctive and coveted.
मैं हटाता हूँ, मैं कलर लेता हूँ। नहीं, कोई और आएगा।
Good evening, respected chief guests, distinguished delegates, respected jury members, all our participants, the nominees, and of course, ladies and gentlemen. We are the official tabulators and process advisors of the FICCI Healthcare Excellence Awards, and I'd just like to briefly take you through the process that we have followed to determine the winners that will be announced shortly. Firstly, the objective of the awards is to recognize and honor organizations and individuals who have made such a significant impact on the healthcare industry. We had a call for entry process across 5 general categories: excellence in patient safety and care, excellence in patient safety delivery, training and skill development, digital transformation initiative, excellence in community engagement. We are overwhelmed with the response in terms of the number of applications that we have received. There were several rounds of evaluations. EY did the due diligence with respect to the eligibility criteria. We had an expert jury panel that looked at all the case studies, the supporting documents that were submitted by all, and evaluated them on predefined evaluation parameters to determine the finalists in each category. We also invited the finalists to present to our esteemed grand jury panel, and on the basis of their scores, we have determined the winners. With respect to the background check, we also had Dr. Bhatia's team, the Astron Hospital Network, that had supported us for the on-ground validation. On behalf of Ernst & Young, I'd like to congratulate each one of you for participating and making this award a huge success. And I'm pretty sure that the case studies that will be showcased will inspire all of us to make this edition bigger and better. Thank you so much.
Thank you very much, Sakshi, for your explanatory address. We appreciate the jury's fair and wise judgment in evaluating the applications, which has helped the awards emerge as a definitive recognition for best practices in the healthcare industry under the aegis of an esteemed jury panel. We are extremely thankful to the jury chair, Sri C.K. Mishraji, for providing his guidance, his experience, and time in evaluating and selecting the winners, and requesting him to address the participants now. Thank you.
Thank you very much. Good evening, ladies and gentlemen. Our chief guest for this night's function, Madam Samilita Gaur, Dr. Harsh Mahajan, Sanjeev Singh, and many familiar faces that I see in front of me. You know, it's been quite some time since I left the health ministry, but these functions bring me back and ensure that the health doesn't leave me, although I have left that department long time back. It's absolute pleasure to be a part of this celebration tonight, and I do really hope that is a celebration, no lessons, no learnings tonight. Let us just celebrate good work that people have done. My congratulations to all the winners. Great job done. And also to all those new applicants who've come in with new kinds of work and have shown the jury what the health sector in India is capable of doing. Thank you for your great work. I do have a complaint to all the applicants though. Don't make the life of jury members so tough. And you don't have to make the competition so close and so tough. Having said that, let me tell you that we had an outstanding jury. So outstanding and so hardworking that, believe me, I had no role at all. And if I keep getting such strong teams, I think I'll be soon out of business. But thank you very much for the contribution you made. I'm not going to get into the details of how the jury came to conclusion. because I think Sakshi just explained that, and Ernst & Young is the organization that leads it. I'll leave it at that. But I'll just try and share a couple of thoughts very quickly with you. Recognizing good work is perhaps the best encouragement that an organization like this can give to anyone. I never tire of saying that in the Indian scenario, we are a little hesitant about being excited about success. We are underplayed always. There's some amount of celebration when it comes to your own success, but very little celebration when it comes to somebody else's success. But I think if you really need growth, if you really need progress, it's time that as a society, we all stood up and celebrated everybody else's success. And I do believe that this evening may prove to be just one of them. It is about acknowledging. It is about thanking. Ladies and gentlemen, the health sector has come a long way. We are far better than what we were about 20 years from now. But if you look at it very carefully, we are still short on various things. And we need to do a lot of hard work. So we really need to pull our socks in the health sector and try and see that newer things happen. It's not about policy, it's not about what's happening. It's about the new minds that will ignite new ideas to ensure that there is access of healthcare to everyone at an affordable cost, with reasonable quality, and above all, strong sense of equity. The people in this hall are the ones who've reached healthcare to a huge population. But let me also put a word of caution that the healthcare that you are reaching is inequitable. And I think if the private sector comes up very strongly, which they are immensely capable of doing, and get that equity in place, a healthy India is not a long-distant dream. Let me just share 3 quick thoughts on this. First, I would have really been extremely happy as jury chair if I had seen more action in terms of primary health care on the table. Preventive, promotive health, more participation from there. Second, there's so much of good work happening all over. I don't know if we have a methodology by which, instead of them reaching us, we can reach them and get them onto our table and evaluate them. And third, a small advice to FICCI. You're doing a great job by acknowledging this, great job by rewarding good work. Perhaps time has come when, as an organization, FICCI needs to associate itself with the entrepreneur right from the word start, nurture it, encourage entrepreneurship, and encourage innovation in them. And then perhaps come to this stage of rewarding them or awarding them. I hope I am not asking for too much from FICCI. It's an organization which needs to ground entrepreneurship in such a way that they're able to grow all over the country. And I'm sure they're doing a great job. But lovely job by FICCI. Thank you very much. And let me thank FICCI. Let me thank my colleagues on the jury. Let me thank Ernst & Young and all of you, ladies and gentlemen, for this night today. I think we've come a long way. I would leave you to the celebration and Mr. Gaur. Thank you very much.
Thank you very much, sir, for sharing the experiences and observations of the jury while assessing these awards. And also, a big thank you to you for all your suggestions and recommendations. We are extremely grateful to have Ms. Sharmila Tagorji here with us to present the awards to the winners. I, with pleasure and pride, request her to kindly address the august gathering here.
Thank you so much for inviting me here today. Sanjeev Singh ji, C.K. Sharma ji, Harsh Mahajan ji, and all of you, all the participants and all the jury members. I think you've done a wonderful the way you presented today. And when you said the house is full, I'm sure you must have cracked a whip because I think it's dinner time and people have been busy all day. But you must have said you have to attend, right? Well, thank you very much. But I have a confession to make. You know, I almost didn't come because I was so, Bishan's passing has unsettled me so much because he was such a good friend of Tiger's. And very few now remain of that time. And I just didn't have the mind space and I couldn't get into, fancy clothes and sort of come and, address a public gathering. But the immediate thought after that was, why not? If all these wonderful doctors and all these wonderful care had not been given to Vishen, we might have lost him 3 years ago. So, and also the same experience I've had also, C.K. Sharma ji said there's much that is required. And you also stressed on the point of equity where I couldn't agree with you more, primary healthcare. But speaking from my own experience, I have been so fortunate that my parents, my mother-in-law, my husband, of course, had IPF, which there was no cure of. But from the beginning, when it was detected at your center and then onwards, there was such wonderful palliative care that he got, which is also so important because it took the load off us because we felt everybody was trying their best. And when it comes to me, I had a scare, as some of you know. I had this persistent cough, and somehow because of Tiger's cough, which we kind of neglected to begin with, sort of saying it's acidity, it's this, that, and the other. And then I went to the doctor, and they said, do an X-ray, and that showed up something, but nothing was conclusive. PET scan was not conclusive. And they, you need to have better machine. Anyway, so I was told that I needed VAX, so that they can be sure. And everybody, I was told that it's 99% it's benign, but it was not. So when they found out, I'm sure there must have been a kind of commotion at the theatre, at the operation theatre. But they did such a wonderful job that, everybody runs for, Europe, America, etc., for any major surgery. But I was so happy, and they took everything, whatever needed to be taken out. And 6 years on, my PET scan is clear. I mean, So I know there is a long way to go forward, but I think our doctors are just fantastic. Like during COVID, for instance, I mean, we don't still have data of how many doctors actually died, how much, what happened on the ground there. But I mean, I went for my colonoscopy and met Dr. Sood, who was wearing sort of that Martian deer in that heat and working. It's just absolutely fantastic. And I thank FICCI for inviting, and I think Mishra ji had made several points, and I agree with them totally. And from the beginning, but even now, the encouragement that all these wonderful doctors are going to get today, I think it's as you say, that when it comes to us, it's different, but when it praising somebody else and giving that incentive, I think it's so important. And FICCI has been doing it every year. So thank you, FICCI, and not just in this medical field. In other fields, I've interacted with FICCI on many occasions, and they're so dedicated, and we need more organizations like that, and this kind of. And I know there is more innovations to happen, and it will with technology. Now, let's say chemotherapy, for instance, whatever happens elsewhere, you get the protocol here, right? So, there is really no need to run away and have spent lots of money and get things done. But certain things, of course, you need to, and if you have the opportunity, you go. But again, coming to equity, this kind of care and facility should be really available to all. And again, going back to COVID and going back to those horrible 3 years, like people died for the lack of oxygen, people died for the lack of ICU beds. Perhaps, again, maybe some monstrous disease is waiting at the corner, and we should be prepared for that. We should upscale everything, and the preparedness must be there. But I think India did a wonderful work with vaccine and everything else. So I don't want to step into the medical knowledge and medical field. I think there are experts here who can talk about that better. But I have been involved, as you said, with UNICEF, and I was closely involved with HIV and AIDS those days when it was a death sentence, really, and ARV and, all that, and how our pharmaceuticals, when Cipla was offering something for a very low price, we were buying from Clinton, whatever organization, and from Bill Gates, right? So then that pharmaceutical gap was mended, and then we were helped because of that. So things like that, if we can create bridges, and so I had that experience. And then from maternal health and infant mortality, and how the first 24 hours matter, and people seek help. Sorry, I'm coming back to your equity. Like barbaric things happen, because I remember going somewhere which is about kind of high up. It's only 2 kilometers, but it's very, very inaccessible in Maharashtra. And I was quite amazed to see that the visitors' book was signed by very prominent people. So I said, "Are you sure these people came here?" Then somebody confided that the visitors' book came down, and it was signed and it was taken up. So the last mile, easy, sort of low-hanging fruits are okay, but that last mile we really need to cover. These little hamlets, where when you need to go to the hospital, first there is a delay, there is no transport, then you go to the first center, then you find this, that, and the other is not there, then you have to go somewhere else, then there is a caste problem, then people leave things on the floor, they don't touch them, then, holding hand with nurses. Somebody mentioned nursing. That was at my meeting in the morning. So it's so important, that care that the nurses can give. And that is where there is so much attrition, there's a gap. The doctors are excellent, but you need nursing. And what do we do about that? How do we create that force? They all come from Kerala, mostly. Like I remember I said, I'm feeling warm, and they ran and got me something. You want to vomit. So there is that language issue. But I'm just saying there are so many aspects of the medical thing, and just mention nursing. And then this acid survivors that I work with, Dr. Kuldeep it's totally, the doctors are pro bono. Wherever I've been, but the hospitals charge, I suppose they have to do that. So I've had really wonderful experiences, and I found the doctors extremely generous, and they're prepared to do it. But, the primary health workers in the villages, so they need to focus, and they are the first person, during pregnancy, when they go from door to door and make them aware of the 3 vital things that they have to do to save a child. Sometimes if you are late going somewhere, then you have mental retardness, because you're wasting time. So just a little thing. And women, unfortunately, are always fed less. Education always goes to the male child. I was given a lot of 3-page thing. I think I've deviated from that totally because of what you started, sir, and how well you spoke. And I don't want to keep you away. I'm sure a thirst must be building up, and your body says we must eat. And also the participants who've been waiting for so long, and that is the main thing why we are collected here, to give away the prizes. And I'm also very eager to meet all those wonderfully talented doctors. So with that, I will stop here. And it's wonderful meeting you, and thank you, FICCI, and thank you, everybody. And we must take home what C.K. Sharma ji said, and we must reflect on that and really, really make it happen. Thank you very much.
Thank you very much, madam, for your kind and motivating words. And like me, if every one of you are just awestruck with her aura, a huge round of applause for her. Thank you. Thank you very much. It's the evening of celebration and taking home happiness. We start with the general award categories. This year, we received 192 entries from more than 100 organizations across the country. And the first category is Excellence in Patient Safety Care, where we have 3 subcategories, beginning with Excellence in Patient Safety Care, Private Hospitals. Let's have a look at the nominees on the screen.
The occasion of 15th FICCI Healthcare Excellence Awards. We come together to celebrate and honor the exceptional individuals and organizations that have left an indelible mark on healthcare landscape. Their unwavering commitment and groundbreaking innovations have not only transformed lives, but have redefined the very essence of healthcare excellence. Nominations in the category of Excellence in Patient Safety and Care for Private Hospitals are Apollo Speciality Hospital, Jayanagar, Bangalore; Kaveri Hospital, S.L. Raheja Hospital, a Fortis Associate; and Zydus Hospital, Ahmedabad.
I request Ms. Sharmila Tagore to announce the winner, please.
The winner is Zydus Hospital, Ahmedabad.
Sir, you're requested to kindly take up your seat, please. We'll request you to climb the dais. Many congratulations. Now for Excellence in Patient...
The patients can get the perfect treatment like the main city hospitals in the peripheral area. So to integrate with all the CT scan and MRI center with the AI-based tool, and which can be connected directly to the emergency room like the central server like 108, and then we can direct the treatment like Uber like app. We can direct the patient that you are here, and according to your situation and your condition, you can transfer immediately to the nearby spoke center.
Congratulations. Now for Excellence in Patient Safety and Care Public Hospitals. The nominees are
Nominations in the category of Excellence in Patient Safety and Care for Public Hospitals are Civil Hospital Ahmedabad, Government Spine Institute Ahmedabad and UN Mehta Institute of Cardiology and Research Center.
I request Ms. Tagore ma'am to announce the winner, please.
Civil Hospital, Ahmedabad.
Congratulations.
Indo-American collaboration for treating a bladder extrophy epispadias complex. The problem is bladder extrophy epispadias complex is one of the most devastating severe congenital urological anomalies. The uniqueness of this collaboration is we have 100% follow-up of all the patients operated in the last year and in the last couple of years.
And the third is Excellence in Patient Safety and Care, Other Healthcare Providers. Let's have a look at the nominees.
Nominations in the category of Excellence in Patient Safety and Care for Other Healthcare Providers are Dr. Dang's Lab LLP, Venus Remedies Limited, Wellspring Healthcare Private Limited and Wipro GE Healthcare Private Limited.
May we request Mr. Gore to announce the winner, please.
And the winners are Dr. Dang's Lab, LLP and Venus Remedies Limited.
Our team embarked on this very innovative and path-breaking initiative of launching bacteriophage sensitivity testing in India that further enables patients to get phage therapy from Eliava Institute that is based in Georgia.
Congratulations to all the winners in
We
this
have
category.
established state-of-art first organ-on-a-chip model in India. We can say this is first. I think there is no pharmaceutical company which have such kind of facility.
So foremost, we request the winner, Zydus Hospital, Ahmedabad, to kindly step and receive the award. You can step the dais from that side and just disembark from the center. Please welcome, sir. We now call upon stage Civil Hospital, Ahmedabad. It's for the initiative Indo-American Extrosophy. Congratulations. We now call upon stage Dr. Dang's Lab LLP. Congratulations. And now we call upon stage Venus Remedies Limited for the initiative Human Organ on a Chip Lab. Congratulations. Thank you, dignitaries. You can take your seats now. So you can take up your seats, please. Yeah. Thank you. We shall now move towards category 2, excellence in patient service delivery. We have 4 subcategories in this, beginning with excellence in patient service delivery, private hospitals. Let's have a look at the nominees.
Nominations in the category of excellence in patient service delivery for private hospitals are by Jerbai Wadia Hospital for Children, Fortis Hospital Mohali, ACE, Fortis Hospital Mohali, Quality Assurance in PCOT, and Padwal Women's Super Speciality Hospital.
I will request Mr. Gore to announce the winner.
Padwal Women's Super Speciality Hospital.
When I start the initiative simple, no money if not survive. That facilitate all the critical mother timely admit at our hospital. And because of that admission, the many of the maternal health indicator like maternal mortality, neonatal mortality, near miss mortality, that decreases drastically.
Also, the awards jury felt that a special jury recognition should be granted in this category to Bai Jerbai Wadia Hospital for Children for the initiative Perinatology and Fetal Medicine Services. We congratulate them. They are not over here to receive this award. Thank you. We now move to the excellence in patient service delivery public hospitals, and the nominees are
Nominations in the category of excellence in patient service delivery for public hospitals are Civil Hospital Ahmedabad, Government Spine Institute Ahmedabad, and King George's Medical University.
I request Mr. Gore to announce the winner, please.
King George's Medical University.
We will use the latest technology to identify the species. Mucor has multiple species. We'll identify the species, do a sensitivity testing, and with the present, whatever scientific knowledge was there already available, with that we will identify a molecule and use them in only those patients who could not go ahead with the continuation phase of isavuconazole or posaconazole.
Excellence in patient service delivery, other healthcare providers is the next category. And the nominees are
Nominations in the category of excellence in patient service delivery for other healthcare providers are Care Health Insurance Limited, Fresenius Medical Care India Private Limited, and Krishna Diagnostics Limited.
I request ma'am to announce the winner, please.
Care Health Insurance Limited.
We went and created a network of hospitals. We tied up with partner network. As of today, we have almost 3,900 hospitals that service these claims for us in the rural hinterlands. We made the servicing also very easier. What we did with the hospital was tied up with fixed amount of packages, and for medical day it was a per day admission kind of packages. So servicing used to be easier.
Next is Excellence in Patient Service Delivery Startups. Let's have a look at the nominees.
Nominations in the category of Excellence in Patient Service Delivery for Startups are Care for Parents, Ramja Genosensor Private Limited, Tech Eagle Innovations Private Limited, and Vinam Health Tech Private Limited, Hexa Health.
I request ma'am to announce the winner, please.
Tech Eagle Innovations Private Limited.
So far is that we have launched Asia's first on-demand drone delivery hub and spoke network, live and running. As we speak, it's delivering medicines, impacted 10,000 lives, reduced delivery time by 1,000%, and we have already delivered 1 ton payload in a 10,000 kilometers worth deliveries.
Congratulations to every one of you. And now we request Padwal Women's Super Speciality Hospital to kindly step in the dais and receive their trophy. We now call upon King George Medical University on the stage. Congratulations. We now call upon stage Care Health Insurance Limited. Congratulations, and now request Tech Eagle Innovations Private Limited to kindly receive their accolade. I now request dignitaries to take up their seats, please. We're moving to the category 3, Training and Skill Development Initiative of the Year. We have 2 subcategories in this category, beginning with Training and Skill Development Initiative of the Year, Hospitals, Health Tech, Other Healthcare Providers. Let's have a look at the nominees, please.
Nominations in the category of Training and Skill Development Initiative of the Year for Hospitals, Health Tech Companies, Other Healthcare Providers are Alcon Laboratories India Private Limited, Aster CMI Hospital, Dr. Lal Path Labs Private Limited, and Piramal Swasthya Management and Research Institute.
We'll request ma'am to kindly announce the winner, please.
Alcon Laboratories India Private Limited.
Most common cause of blindness is the complications that result from cataract surgeries. So Alcon's FICCI development initiative actually looks at reducing these complications by improving the surgical skills, by increasing the technology and the technique adaptation of ophthalmic surgeons across the country.
We now have with us Training and Skill Development Initiative of the Year award, that is the medical institutes and colleges. The nominees are
Nominations in the category of Training and Skill Development Initiative of the Year for Medical Institutes, Colleges are Dr. D.Y. Patil Vidyapeeth, Pimpri, Pune, and Dr. Ram Manohar Lohia Institute of Medical Sciences, Lucknow.
I request ma'am to kindly announce the winner, please.
Dr. Ram Manohar Lohia Institute of Medical Sciences, Lucknow.
The degree of improvement was definitely there in the percentage of our healthcare associated infections which really have come down. The period of impact still continues, and the benefits for patient was in the decreased rates of infection, reduced hospital stays, reduced cost of treatment, and therefore increased patient satisfaction.
We now move to another category, which is Excellence in Community Engagement. Here we have 2 subcategories, and beginning with Excellence in Community Engagement, NGOs, not-for-profit organizations. Let's have a look at the nominees, please.
Nominations in the category of Excellence in Community Engagement for NGOs, not-for-profit organizations are Bangalore Baptist Hospital, Genesis Foundation, Piramal Swasthya Management and Research Institute, and Resource Group for Education and Advocacy for Community Health, REACH.
May I request Ms. Tagore to announce the winner, please.
And the winner is Genesis Foundation.
We are one of the few NGOs, in fact one of the only NGOs which is supporting children, underprivileged children born with a congenital heart defect pan-India. Here we have said that we've saved lives of 4,200 plus. The number has now changed from the time we submitted this presentation. We're now at 4,300 plus. To do this, we partner with, again, the number has changed. We're now partnering with 40 hospitals across the country.
Congratulations. Now moving to Excellence in Community Engagement for Profit Organizations. And the nominees are
Nominations in the category of Excellence in Community Engagement for Profit Organizations are Aster MedCity, Ganga Medical Center and Hospitals Private Limited, and Johnson & Johnson.
I request Mr. Gore to announce the winner, please.
And the winner is Ganga Medical Center and Hospitals Private Limited.
The idea of Project Shakti is to identify breast cancers early so that the right appropriate treatment at the right time can save women's lives. So this is our goal and our purpose.
Moving on to the next categories. Digital Transformation Initiative of the Year. We have two subcategories, beginning with Digital Transformation Initiative of the Year, Hospitals, Other Healthcare Providers. Let's have a look at the nomination.
Nominations in the category of Digital Transformation Initiative of the Year for Hospitals, Other Healthcare Providers are Civil Hospital Ahmedabad, Extended Reality Lab, Amrita Hospital, Kochi, Amrita Vishwa Vidyapeetham, and Sir H.N. Reliance Foundation Hospital, Mumbai.
May I request ma'am to announce the winners, please?
And the winner is, again, Ahmedabad Civil Hospital.
Digital Bharat Mission. We have started one more initiatives for the civil hospital interdepartmental reference. So far in a 1 year it is like 1.7 lakh reference has been done. Before that we didn't know how many references are actually being done, but because of this web portal now we come to know which department is how many cross reference are happening in the department.
And next category is Digital Transformation Initiative of the Year, Startups. And the nominees are
Nominations in the category of Digital Transformation Initiative of the Year for Startups are ANH Technologies Private Limited, Claim Therapist, CrossScope, Scope Stack Innovations Private Limited, Health Arcs Technologies Private Limited, Beto, and Uberakshi Business Solutions Private Limited, Myreska.live.
I request ma'am to kindly announce the winner, please.
ANH Technologies Private Limited, Claim Therapist. Lots of supporters here.
Now the bedrock of this platform is technology. Our system is enabled to understand the policy terms and condition. Machine can read it, validate it, and it can and provide multiple use cases for the hospital and for the patients at the same time. In the past 3.5 years, we have processed over 500,000 cases across all the hospitals.
Congratulations to all the winners, and it's now time to award them with the trophies and the certificate. I request the esteemed dignitaries to do the honors. Foremost, we'll call Alcon Laboratories India Private Limited. Congratulations and best wishes. Now we call upon stage Dr. Ram Manohar Lohia Institute of Medical Sciences, Lucknow. We call upon stage now Genesis Foundation. We now call upon stage Ganga Medical Center and Hospitals Private Limited. And one more time, the winner, Civil Hospital Ahmedabad. Welcome on the stage, please. Help me welcome on stage ANH Technologies Private Limited, claim therapist. Thank you, and I request the dignitaries to take the seats, please. Now we are moving towards the individual awards, which are not applied for but are nominated by FICCI health committees and awards jury members. The first award in this category is Chairman's Award for Outstanding Leadership in Healthcare, to recognize individuals who have made exceptional and transformative contributions to the healthcare sector. This award has been introduced this year to celebrate the often overlooked champions in the healthcare realm, those dedicated medical and nursing professionals who serve as the driving force behind the success of many healthcare institutions. The award is not focused on clinical excellence, but rather on the individual's administrative acumen and skills, who have pioneered and ardently championed transformative initiatives, yielding significant improvements in the organization's operations, patient care, and overall effectiveness. I request Mr. Gore to kindly announce the awardee, please.
And the winners are Dr. Bishnu Prasad Panigrahi and Miss Gracie Mathai.
Thank you very much, ma'am. I request Dr. Bishnu Panigrahi to come over on the stage, but after the video is being played.
Chairman's Award for Outstanding Leadership in Healthcare. Dr. Bishnu Prasad Panigrahi, Group Head, Medical Strategy and Operations, Fortis Healthcare. Dr. Bishnu Prasad Panigrahi is the Group Head, Medical Strategy and Operations at Fortis Healthcare. Dr. Panigrahi has an illustrious career spanning various facets of the medical field, encompassing academia, clinical anesthesiology, and healthcare administration. Dr. Panigrahi served as the CEO, Kalinga Institute of Medical Sciences, during his tenure at KIMS at the time of COVID-19 pandemic. He successfully led the collaboration between the government of Odisha and KIMS and initiated the establishment of specialized COVID-19 hospitals in Odisha at Fortis Healthcare. He has been leading the functioning of continuing medical and nursing education. Through his efforts, he has successfully created a distinctive platform aimed at enhancing the skills and knowledge of both medical and paramedical personnel, fostering a shared commitment to training and development. FICCI deeply appreciates the immense contribution and proven leadership of Dr. Bishnu Prasad Panigrahi and takes immense pleasure in conferring the Chairman's Award for Outstanding Leadership in Healthcare on him.
Congratulations, Dr. Bishnu Panigrahi. We request you to kindly receive the award by the august hands of our chief guests and the esteemed dignitaries. Request sir to kindly say a few words.
First, I'd like to thank FICCI for this because I feel humbled, and getting it from a stalwart from the Indian film industry has a great meaning, because amongst the diversity that India is, I think so there's a unity there in the film fraternity, and that is the same thing with healthcare, I think so. We cut across all diversity, and so that's something I would like to say. And I've come from a small town, Sambalpur, and I think so this is an inspiration for the youngsters, that if you work hard, sky is the limit. And I would like to say a few words is that I want to thank two people. I think so in the healthcare sector should always remember Dr. Pratap Reddy. I think so if we are here as a strong healthcare force recognized in India, abroad, I think so Dr. Pratap Reddy gets a lot of praise for that. And I was the first anesthesiologist at Indraprastha Polo when it started in 95 December. I learned a lot from him. So I think so I must pay my homages to him and say that because of him we are here. And the next part, ma'am, is I think so I'd like to say that it's a very important thing. I would have stayed back in New Zealand. My professor was telling me to stay back because he had offered me a consultant job in 92. And that's the time I met Dr. Narottam Puri when the World Cup was happening there. He had come on as commentator. I didn't know him then. And but my wife told me, we have to go back. You did medicine to serve your country. So I think so 90% of the credit is to her. Thank you.
Thank you very much, sir, for those lovely words. And now I request Miss Gracie Mathai.
Chairman's Award for Outstanding Leadership in Healthcare. Miss Gracie Mathai, CEO, Baby Memorial Hospital, Calicut, Kerala. Gracie Mathai is a seasoned professional in the field of hospital administration with over 4 decades of experience. She holds the distinction of being the pioneering nurse to assume a leadership role in a hospital. Her journey begins as a nursing director in Mumbai, then GM of Administration and HR at MIMS Calicut, COO at MIMS Kottakkal, eventually serving as a Chief Quality Consultant at Aster DM Healthcare. She further excelled to be the CEO of Baby Memorial Hospital. Her contribution to the National Accreditation Board of Hospitals and Healthcare Providers (NABH) from its inception in 2005 in various roles ranging from Principal Assessor, Member of Technical Committee and Accreditation Committee, and Faculty for Training Programs has been immense. She led MIMS Kozhikode to get the first NABH accreditation in the country and Aster MedCity Kochi, where she worked as Chief Quality Officer, received ISO 9008, NABH, JCI accreditations within 7 months of the hospital commencement. She received the Best Nursing Administrators Award from the Mumbai Municipal Corporation in 1999 for her pioneering work in nursing administration. FICCI deeply appreciates the immense contribution and proven leadership of Ms. Gracie Mathai and takes great pleasure in conferring the Chairman's Award for Outstanding Leadership in Healthcare on her.
Warm good evening to each one of you. At this particular moment, I have only one word in my mind, that is gratitude. Let me thank God Almighty for giving me strength as well as health to achieve these type of awards in my life. And also my gratitude to FICCI for considering me for this particular award. I feel to be honored. Of course, my thanks goes to my colleagues who are part of my journey and who have encouraged me from the beginning until now. If I won't say one word about my family, that support of my family was great. So my thanks again go to my family. I have special thanks for few group of people who have come on my way or who have pulled my hands and brought me to this level, that is NABH, QCI, CAHO, and Trained Nurses Association of India. I thank each and every one of them for helping me to come up to this level. Thank you so much.
Thank you very much, madam, and congratulations as well. Healthcare humanitarian, to recognize a social activist who has made an outstanding contribution to the healthcare segment in India, a measurable impact in making quality healthcare available in the country without any profit or business motive. Let's first have a look at the previous year's awardees in this category. Congratulations to all of them for the last year's winning. I now request Ms. Tagore to announce the Healthcare Humanitarian Award for this year.
And the award goes to Dr. R. Ravi Kannan.
Healthcare Humanitarian, Dr. R. Ravi Kannan, Director, Kachar Cancer Hospital and Research Center, Silchar. Dr. Kannan is currently the Director of Kachar Cancer Hospital and Research Center, Silchar, Assam. He is a surgical oncologist who specializes in head and neck oncology and bone and soft tissue sarcoma. He is known as Silchar's savior, as his vision has turned a small cancer center into a full-fledged hospital in Assam's Barak Valley, making healthcare accessible, as the nearest hospital was 300 kilometers away. He has treated over 70,000 cancer patients free of cost and has been acknowledged as one of the unsung heroes. He introduced several pro-poor initiatives for people from all socio-economic backgrounds, and besides providing free treatment to cancer patients, the hospital also provides accommodation and food, temporary employment opportunities for caregivers, and a home care program. The unwavering mission of Dr. Kannan and the hospital is clear. No one should be denied access to treatment due to want of money. In acknowledging his lifelong devotion to his profession's highest ideals of public service, he has been named one of the 4 winners of the 2023 Ramon Magsaysay Award, Asia's equivalent of the Nobel Prize. He has also been conferred with the Padma Shri in 2020 and the Mahavir Award in Medicine in 2013. For his dedication, commitment, revolutionary and selfless contribution to community healthcare, FICCI is proud to present the Healthcare Humanitarian Award to Dr. R. Ravi Kannan.
We congratulate Dr. R. Ravi Kannan. As Dr. Kannan is unable to join in person to receive the award, Dr. Aditi Chaturvedi, a surgical oncology colleague of Dr. Kannan, is accepting the award on his behalf. Congratulations, and let's hear the recorded message from Dr. Ravi Kannan.
Namaskar and good evening to all of you. Thank you to the Federation of Indian Chambers of Commerce and Industry for this honor and this opportunity to address all of you. I would have actually liked to be there in person, but unfortunately circumstances just now don't permit it. Please accept my apologies for that. I accept this honor on behalf of a large number of people, my colleagues in the organization, the members of our society, people in the community here, individuals and organizations elsewhere in the country and abroad who have contributed in very many ways, through ideas, through donations, through criticism, through training, so many ways, selflessly, without expecting anything in return. Some of them are known, some of them are unknown, seen, unseen, some of them have been acknowledged, many of who will never ever visit this place, yet they have taken a leap of faith to support the work with the sole intention of making a difference in the life of fellow human beings on this planet. And I think this award recognizes that hand-holding amongst people, all over the place who have just the idea of, selflessly supporting lives of other people. Thank you very much for doing this. God bless you. Stay safe and stay healthy.
Thank you. We're now moving to Healthcare Personality of the Year, to recognize a person who has had significant achievements during the past year in terms of business growth, mergers and acquisitions, positive regulatory change, betterment of academia, research, global expansion, etc. Let's have a look at the previous year's awardees in this category. Congratulations to all of the previous year's awardees. And I now request Mr. Gore to announce the Healthcare Personality of the Year 2023.
And the award goes to, for Healthcare Personality, Dr. Vikram Shah.
Healthcare Personality of the Year, Dr. Vikram Shah, Chairman and Managing Director, Shalby Limited. Director, Joint Replacement Surgeries, Shalby Group of Hospitals. Dr. Vikram Shah, Chairman and Managing Director, Shalby Limited. An extensive network of 14 hospitals across 11 cities. In 1994, he founded Shalby, India's first exclusive joint replacement center in Ahmedabad. Today, Shalby is the largest hospital network in Western and Central India, performing over 15,000 joint replacement surgeries annually. His innovations, the OS needle and the Zero technique, have made total knee replacement surgery quicker and safer, reducing surgery time, blood loss, recovery time, infection rates and hospital stays, greatly benefiting patients. Dr. Shah's accolades include the Double Helical National Health Award for the Zero technique, Dr. B.C. Roy Oration and the Hercules Award for Innovation. Shalby Hospitals, under his guidance, has secured more than 50 awards. FICCI deeply appreciates the immense contribution and proven leadership of Dr. Vikram Shah and takes immense pleasure in conferring the Healthcare Personality of the Year Award 2023 on him.
Congratulations, sir, and we request you to step on the dais, please, to receive your trophy. So we request you to say a few words, please.
Dear friends, I feel honored and thank you, FICCI. I am surgeon by choice and an entrepreneur by destiny. I accept this award on behalf of our 15 hospitals, our 5,000 staff members, 2,000 doctors, and I say again thank you. I would like to say here one thing. 50 years back, India was a country of nursing homes and some charitable hospitals. And every person in Delhi, Mumbai or Chennai was going out for major surgeries. In last 50 years, all of us have changed the whole scenario to the level that not only our own people are getting every kind of quaternary tertiary care treatment in our country, but one extreme level of medical tourism where not only it is a cheaper treatment, but certain operations are not done in USA and UK, like difficult joint replacement revisions, for which they keep on coming to India. So we are able to change the scenario in last 50 years from everybody going out or treatment not available to treatment available to all. And last but not the least, with Ayushman Yojana by Prime Minister Modi, it has changed everything for poor people and it is now accessible to everyone. Thank you.
Thank you very much, sir, for your kind words. Now we are moving to the most important award of the evening, which is the Lifetime Achievement in the Healthcare Industry. In presenting the Lifetime Achievement Award, we honor an individual who has left an indelible imprint on the Indian healthcare industry throughout their illustrious career. This distinguished individual, widely acknowledged and revered within the healthcare sector, serves as a beacon of inspiration for present and upcoming healthcare professionals, symbolizing the highest standards of achievement and leadership in the field. Let's have a look at the previous year's awardees in this category. We congratulate each previous year awardee in this category. And for this year, I now request Mr. Gore to announce the Lifetime Achievement Awardee 2023.
This year's awardee for Lifetime Achievement is Dr. Yash Paul Bhatia.
Lifetime Achievement in Healthcare Industry, Dr. Yash Paul Bhatia, Chairman and Managing Director, Astron Group. Dr. Bhatia is the Chairman and Managing Director of Astron Group, which includes Astron Hospital and Healthcare Consultants, Astron Institute of International Studies, Astron Institute of Social Sciences, and Astron E-College. He is also the Chairman of the Advisory Council of Venkateshwar Hospitals, Delhi. Throughout his career span of about 4 decades, encompassing roles in the armed forces, corporate and social sectors, he has made significant and enduring contributions to the domains of hospital planning and management, healthcare quality and accreditation, healthcare academia and skill building and enhancement. He has been instrumental in planning, designing and establishing over 60 hospitals, medical colleges and healthcare institutions. He played a pivotal role in establishment of the Indian Healthcare Accreditation System, leading to the constitution of NABH, where he served as the first chairman of the accreditation committee. He has been a keen academician and has been a global faculty in the field of healthcare quality, evidence-based hospital design and corporate governance. He is the recipient of many prestigious awards including the National Quality Champion Award by QCI, Rajiv Gandhi Shiromani Award and Dadabhai Naroji Lifetime Achievement Award. FICCI deeply appreciates the enormous contribution, selfless dedication and mentoring along with assiduous commitment to advancing quality medical care in the country, which has made Dr. Yashpal Bhatia a role model and is proud to confer the Lifetime Achievement Award in the healthcare industry to him.
Congratulations, sir, and we request you to kindly receive the award, please. Sir, would request you to say a few words.
Honorable Chief Guest for the evening, Sharmila Tagore-ji, Mr. C.K. Mishra, the guest of honor with whom I had the privilege of, the jury discussions for last few years, Harsh, Sanjeev, and Narottam, Dr. Arvind, that all our friends and colleagues over here. I'm really humbled to receive this Lifetime Achievement Award today. Of course, thanks to God Almighty, and thanks to FICCI, and thanks to everyone over here who thought me probably fit to receive this award. To some extent, or maybe to quite an extent, in fact, I start with what Armed Forces gave me an inspiration to work on. Started from my college, Armed Forces Medical College. I remember my days when Dr. Arvind Lal was my warden. And today also, when we are standing outside, he said, "Your tie is not right. This is how it should be." So he said, "College में भी बताया था, वही भी जो सिखाना पड़ रहा है." Then, of course, in the army, got the opportunities, which probably are the lifetime opportunities to do things differently. While we do the medicine, I got opportunity to plan new hospitals, to do work for planning of the Asian Games, to work for setting up of medical services at places like Pokhran, and things like that, which were very different from what a medical officer will normally do in the armed forces. Went for some training in the same, then I thought, why not make hospital planning and management as my career, went abroad, did my education, and came to Delhi as a stranger, as a loner, maybe directionless. But then, I think the industry held my hand. The colleagues from the industry, many of them were sitting here. They held me from the back, front, and of course, the family stood by. Dr. Nehru, my wife, she said, "We are here, we are strangers, but we can make a place for ourselves. Let's work towards that." Through the journey, there were challenging opportunities like setting up the first private sector cancer institute, non-government cancer institute in the country, the Rajiv Gandhi Cancer Institute. And when I took up that project, everyone told me that you have started on a disastrous career graph. But then that became the success model, role model, which changed the cancer scenario of the country. If you look at India's cancer history from 1947 till 1996, 50 years, there was hardly any non-government cancer institute in the country. Everyone thought cancer is something only for the public sector. And one Rajiv Gandhi Cancer Institute became successful. In last 25 years, we have around 200 cancer centers in the country. So it's a kind of total conceptual change, which the institute could bring in the system. Similarly, starting a quality and accreditation journey was itself another challenge, which initiated by the industry itself, and today it has become kind of a one of the leading success factors in the whole of the country scenario. And every such institutional journey or setting up new institutions, I really thank my colleagues, thank everyone in the industry who helped me and stood by me, had faith in me, trust in me to do something which we could do and which could achieve. So today is the time, as I thank FICCI for having honored me for this, given me this honor, I wish to thank everyone in the industry. There are so many of them who have helped me, who have supported me in holding my hand. Of course, with FICCI, I have been associated for more than 12 years now. And 10 years that I have been associated with these awards. Always an award organizer. Today, I am an award receiver also. So thanks a lot for that. Of course, receiving an award from a personality like Sharmila ji is something, which is probably a dream come true. I would say that, when we were youngsters, we could dream of looking at the movies and dream of you in looking at the movies. Today, it's a dream come true that I'm seeing reward from you from that matter. Of course, my gratitude will be incomplete if I don't thank my family for what I have achieved today. My immediate family, my Astron family, with which I grow further. And of course, as I mentioned earlier also, one person who probably held my hand, stood by me, took me forward. That's my wife, Dr. Neeru, who... So whatever we are today, we have walked together, we have worked together. Even when we worked for the award, I was telling Harsh the other day that I get the thanks, she does the work. And that's how it works in the organization we have been working for. But before I close, I need to thank my late parents. In fact, I just want to share with you that it was a botched-up surgery of my mother, who had a fractured tibia fibula only, which led to her not being there with us when I was in the second year of the medical college. When I became a medico, it inspired me that what can I do for quality and patient safety? So whatever passion with which I have worked all throughout for last my more than 3 decades to establish quality and patient safety, not only in India but globally, I think the inspiration comes from my mother, who's left us because of a very, very simple thing like fractured tibia fibula, leading to infection, leading to a nailing, and just at the time of nail removal, dies of pulmonary embolism. That's the kind of thing which was when I was just in the second year of medical college. So, I'm talking of one such incidence where we think the death was avoidable. Probably it was avoidable, and millions of that happen every day, and that's what led me to a journey which is an inspiring journey for my quality and patient journey service. With these words, once again, thank you very much. Thank you, FICCI, and thanks all my colleagues sitting over here for being with me in the journey that we have, which I have acquired so far. Thank you so much.
Thank you very much, sir, for those beautiful words. And thank you, madam. She's been emotional since the moment we announced it. And thank you for giving us such a wonderful doctor to the society. Thank you. Before we move to the vote of thanks, we first wish a photograph of memory with the jury. So foremost, the grand jury, I would request you to kindly step on the dais for a group photograph with our chief guest. And then the interim jury. Thank you. And we now request the interim jury to kindly step on the dais for the group photograph. In order to make this event successful, the days and nights have gone of one team, and that team is FICCI team. I request the FICCI team to kindly step on the dais for the group photograph. If you can, and if you wish, rather you should, give a big hand to the team FICCI. Thank you. Thank you very much. And I now request Dr. Sanjeev Singh, Co-Chair, FICCI Health Services Committee and Medical Director, Amrita Institute of Medical Sciences and Research Center, Faridabad, to extend the vote of thanks. Ladies and gentlemen, we will have the interaction and congratulations during the dinner. Please take up your seats. Thank you.
A very good evening to all of you. Ms. Sarmila Tagore-ji, Shike Mishra-ji, Dr. Harsh Mahajan, distinguished jury members, award nominees, participants and FICCI Healthcare Committee members. 192 entries and 100 organization participation is indeed a great feat which has been achieved. We have gathered here tonight to celebrate the outstanding achievements in the field of healthcare and to honor those who have made remarkable contributions through the tireless efforts, innovative initiatives and unwavering commitment. The theme of the award was Inspire Change Together, which truly encapsulate the spirit and sentiments that resonate within the healthcare community. These awards hold a special place in our hearts as they serve as a beacon of recognition for exceptional individuals and organizations who have come together to make a significant impact. I hope over the years we have managed to create a credible platform that only recognizes but also provides a fillip for further innovations and excellence in awards and healthcare. Allow me to begin by thanking our chief guest, and as it was mentioned that we are awestruck by having her here amidst us, Madam Sharmila Tagore-ji, for accepting our invite and gracing the occasion. And I don't know, Harsh Mahajan-ji felt short in saying that, but you are extremely graceful and very, very gorgeous, madam. I may not have slept well if I have not said that. But it is indeed great to understand that she knows about palliative care, she talks about PET-CT, she talked about nursing, colonoscopy, and being an UNICEF HIV/AIDS ambassador. It's indeed a privilege to have her here. I would also like to take this opportunity to express our profound gratitude to C.K. Mishra-ji, who is our eminent jury panel and who heads the whole work. He has been a true supporter. He recognizes in his word about recognizing good work is critical for progress, and I think we'll take that note in all the future endeavors. He also did mention about involving primary healthcare, preventive, promotive, and nurturing entrepreneurship. So those are excellent thoughts, and I think we would, as a FICCI, take that as further initiative. I would really like to thank Dr. Harsh Mahajan, my mentor and chair of the FICCI Healthcare Committee, who has worked hard with throughout the last year for multiple roundtable meetings. Lots of good work, roadmap to cancer care, new age models have come under his leadership, and his invaluable knowledge, experience and time and selecting the award and the winners have been profound. I would also like to thank Dr. Yashpal Bhatia. Sir, congratulations for winning the Lifetime Achievement Awards. For chairing the award of Core Group, Dr. Ravi Gaur, Co-Chair Awards Core Group, and Dr. Narottam Puri Sir for being the advisor and fantastic support. I would like to thank our process partners, EY and Astron Healthcare. You do amazing work year after year, and it's always fantastic to work with you. who have been supportive in this initiative since its inception and towards this journey. Congratulations to all the winning organizations and the healthcare luminaries for this exemplary work in delivering quality healthcare and helping in shaping good practices and reaching out to the masses. To all the participants who have joined us, thank you for being here today. And finally, my deep gratitudes to all the nominees and award participants for reposing your faith in us and participating in the awards program once again. We'll look forward to your continuous support. And if I have inadvertently missed anybody, I would really like to seek apologies. But thank you, Madam, thank you, Sir, Shiki Mishra ji, Dr. Harsh Mahajan, Dr. Narottam Puri, Brigadier Lal, and congratulations to all the awardees, and let the party begin. Thank you.
Thank you so much, sir, for your warm thank you note. We now request Ritu Mahajan, Dr. Rajiv Singhal, Ms. Upasana Arora, Co-Chair MVT Committee, and PN Arora to kindly step on the stage, please, for a photograph, a memory to be captured. And please join us tomorrow for the FICCI HEAL conference sessions at the conference venue, FICCI Federation House. Thank you, and congratulations one more time. This is Dhwani signing off. Good night, bye-bye. See you tomorrow.